Fall is now winter. The temperature outside has changed. A few other things have to change as well, including the way you take care of yourself. Dr. Howard Brooks is back here with us to talk about why you need to change the way you treat your skin this winter. We think, you know what, I put cream on here and there. Is that good enough? No?
No. Yes and no. I mean, this time of the year, it's colder outside. Most of us have the heat on indoors, so that's pulling the moisture out of our skin. So we have to take extra steps to prepare our skin for that type of weather.
And you brought some stuff along. Let's go over it.
Okay.
This one, I've used Eucerin a lot, and they have one with the zinc oxide I was telling you that really blocks skin totally. I think women women are more into, oh my gosh, I don't want anything on my face. I don't want to be older. What's this one about?
You know, I'm glad that you brought up the zinc oxide because I didn't have an example here, but it is important to wear sunscreen all year round. Doesn't matter your complexion, your gender, because you mentioned women, but we all want to look younger. And unfortunately, I can usually scare people with aging rather than skin cancer, but it's very important.
So something in a bottle can actually help us?
Something in a bottle can help us. You know, we get confused when we go to the drugstores or the supermarkets and we see all these pretty packages. Yeah. It's really not, you know, I brought here some different name brands. It's really not about the name, but the ingredients. It's
very overwhelming. Let's talk ingredients. What in Eucerin is good here?
The glycerin. So
glycerin.
Glycerin all year round, but more so in the winter time, particularly with patients that have eczema and dry skin. All of our skin gets drier. Unfortunately, as we get past the age of 30, our skin starts to dry out. If you have a family history of asthma, eczema, even more so. So you want to protect your skin.
And if you're not drinking enough water, which is hard for all of us.
Exactly. You know, drinking enough water. You know, everything I was telling someone earlier. No one's going to like what I have to say here. So you want to avoid.
You have to be strict. You have to be consistent.
Honestly,
nobody wants to do that.
Avoid very hot showers. Hot showers and hot baths pull the moisture out of our skin. Some simple steps: as cool showers you can tolerate. Don't dry yourself and get bone dry after you get out the shower, but pat yourself dry and put the Eucerin on or put the cetaphil on afterwards, right afterwards.
Because it locks in the moisture.
It locks in the moisture, exactly. Some of those commercials aren't lying. It actually does lock in the moisture.
Finally, advertisers might be telling the truth. As far as ingredients go, doctor, what should we stay away from? You know, if it's on top of the ingredients list, there's more of it. Is there something that we should just steer away from?
Honestly, it really is. You should stay away from fragrances. So, you know, when I'm talking about patients about the soaps they should use and the things they should avoid, they're like, well, what do I have left? Because I tell them to avoid, I hate to say the names, but, you know, avoid anything with fragrance in it, and as well as avoid ivory soap, because the commercial, again, truth in advertising, they say 99.44% soap it is, so that's extremely drying to the skin.
Harsh on you, especially for the face. A lot of people, you know, will use the soap every once and again to wash the face.
Correct.
But
it's a little harsh. It's a little harsh. You know, year round it's harsh. And like you said, you're concerned with anti-aging. Both men and women are, and when you pull all that moisture out your skin, it does make you look a little bit more tired and haggard.
We don't want that.
No one wants that.
All right, number 2, what's this?
I brought that because, you know, you mentioned earlier, everyone wants to stay as young as they possibly can.
Yes.
So this is an Neutrogena's anti-aging serum, but it also has hyaluronic acid in it. And a lot of us know the hyaluronic acid is Juvederm or the facial fillers that we plump in, but they're putting in ingredients now to add moisture to the skin.
And retinol's in this one.
Retinol's in that one, so, you know, I sort of cheat on that because retinol will dry the skin out even more. But I brought that to say they're even putting humectants and different moisturizers in with the retinol.
It seems like, and I may not be up on this, but it seems like these are things you usually get a prescription for.
It is. Those are things, that's the main reason why we use retinol is acne, but it's also anti-aging, so they put it into a lot of the products now.
Something like this runs you what?
I think that's about anywhere from $10 to $15.
That's not too bad.
Not too bad.
Aveeno, we see this everywhere.
Aveeno, their products are great. They add oatmeal to their products. That's also a moisturizer. When your skin gets extremely dry, if you tried all this, you took I'm not going to say cold showers, but if you take the warm showers, you pat yourself dry, you use these products. If you still have dry skin, that's when you want to go see a doctor.
Nobody wants a cold shower. That's
no one wants a cold shower.
I'm looking for the glycerin in this one. Yes, tops the list.
Yep.
Cetaphil. My mom uses Cetaphil. This is the cleanser, but she uses that big tub, and she just lathered. For her age, I'm selling her out. I won't tell her age, but for her age, she's always been good. My mom hasn't worn a lot of makeup, but is always moisturized. Right.
Moisturizing is the key. I brought that because that's a gentle cleanser. It does add moisture to the skin when you cleanse, as opposed to some of the more drying bar soaps.
And this one, well, it starts off with alcohol, but I mean, all of them have some of that.
All of them have some alcohol. All of them have water. That one does, I believe, contain glycerin, but it's a non-fragrant, very gentle cleanser that won't strip your skin of the moisture.
That's good. Next up, this pretty little package.
I brought that one because, you know, this is something you can't find in the store. This is something you would find in either a dermatology office or a plastic surgeon's office.
It's called,
it's called Vitaphenol. And the Vitaphenol, it's a relatively new company, but they have, this is a daily fortified moisturizer, and I bring that to say that a lot of times people want something that's a little bit more cosmetically elegant, or that you can you know, that's the more exclusive. That's a little bit, that adds a little bit more anti-aging to the skin, and that's what this comes in.
Sometimes ladies feel like they have to spend a little bit more, go to the Clinique counter at the department store or something else, and I think part of it just makes us feel better, even though we don't want to spend the money, but feel better because we're buying more. It's pretty packaged.
Pretty packaged.
Truth is,
honestly, you can find, and I say this, you know, you don't have to get the Aveeno. Right next to Aveeno, CVS makes it so easy for us now. Their packaging is almost identical to the name brand.
You know, I'm glad you bring that up. Let's talk about that. When you're in CVS, you're in Target, everybody has the generic store brands.
Exactly. This really is no different. Still the same. I mean, in my medicine cabinet right now, I have the CVS Aveeno lotion, and that's what I use on a daily basis.
Oh, nice.
Yep.
If the doctor's doing it, then we can do it too.
That's how you don't have to pay for the advertising.
It's all just big name brands and stuff like that.
Exactly.
Should people right now with winter, let's go over the SPF really quickly.
Okay.
You see 15, you see 30, you see 45. What's adequate for just going out in the winter, walking to work, walking home?
I'm glad you asked. Just any day, SPF 15 or above is fine. I say as long as you're putting 15 on, reapplying during the day, and it's not just during winter, it's 365 days of the year.
So 15 is enough?
15 is enough.
Okay, we're good to go with that.
We're good to go.
Doctor, thanks for coming back in.
Thank you for having me.
Dr. Howard Brooks, good to see you.
Good to see you again as well.